So what's the difference between a psychiatrist, a psychologist, and a master's level therapist? It almost sounds like a bad joke. So psychiatrist, a psychologist, and a therapist walk into a bar. Hey, I'm Dr. Harry McCleary, licensed clinical psychologist and Navy veteran. And I spend the majority of my week talking to this nation's warriors about their feelings. In this video, I'm going to talk about what's the difference between psychiatrists, a psychologist, and a master's level therapist. For me, this is both an easy question to answer and a complex question to answer. So I'm going to answer it in two ways. First, I'm going to answer it in the easy way. The most simple difference, and probably the most obvious, is the levels of education. So a psychiatrist went to med school, so they have an MD most likely. A psychologist has a doctorate degree. And a master's level therapist, guess what? They have a master's degree. Take me for example. I am a licensed clinical psychologist and I have a PhD. But doc, don't you also have a master's degree? Yes. But I'm different. So my own path, I actually have a terminal master's degree to where I can practice at the master's level, or could have stopped my education at the master's level and provided therapy to people. But I decided to go get a PhD after my master's degree and after I had practiced in the field as a master's level therapist. Well, why'd you do that, doc? Well, that's a complicated story, but basically because I'm a glutton for punishment. How about that? The next differences between psychiatrists, psychologists, and therapists is their different roles. So in regards to a psychiatrist, their primary role is as a mental health physician. So they are the ones that are going to, for the most part, prescribe you your psychotropic medications. Psychologists are a little bit different. For the most part, psychologists do not prescribe medications. I get asked all the time, okay, well, doc, can you prescribe me some meds now? No, that's not what I do. Psychologists are experts in psychotherapy, in assessment, and many psychologists are also experts in research. There are many types of licensed master's level clinicians. So you have licensed clinical social workers, licensed marriage and family therapists, licensed professional counselors. All of these professions are trained in psychotherapy and really the basics to a high level of psychology and human behavior. So which one is the best? Psychologists, obviously. That's not a biased opinion. We all play our own roles, and there are variations in all of those professions. Robin Williams in Good Will Hunting is a psychiatrist, yet he's doing therapy. That's not done as much as it used to be. For many years, psychiatrists were also doing a fair amount of therapy. But now if you're going to become a psychiatrist now, you're not even going to get a lot of training in that area. The psychologists and master's level therapists are the ones that are experts in that area and not the psychiatrists for the most part. So you're a patient or a client and you feel like you need a medication consult. Who do you choose? Psychiatrist. Correct. So you're a patient or a client and you really want to do some comprehensive assessment, really see what's going on. Or maybe you're having some cognitive issues, some memory difficulties, and you want to be assessed to see if this is some type of mental health disorder, or if you may have some early onsets of Alzheimer's or something along those lines. Who do you see? Psychologists, correct. Now you're having some trouble with your mental health and you want to seek out some psychotherapy. Who do you call? This one's a little bit different. You can do a psychologist or a master's level therapist, or maybe even a psychiatrist that is trained in psychotherapy. You have that choice here. And as somebody that has both a master's degree and a PhD, I would say that it's more important that you focus on somebody's specialty. So if they're a master's level clinician that specializes in trauma and you're struggling with post-traumatic stress, I would put them over a psychologist that doesn't specialize in post-traumatic stress. Does that make sense? So when you're talking about psychotherapy, you have a lot more options, but don't limit yourself just to somebody that has a lot of letters behind their name. Maybe the right therapist for you doesn't have those things. Maybe the right therapist for you is one that you just feel comfortable with. And I would say, in my own personal and professional opinion, the clinician that works best for you is the one that helps you, the one that you feel comfortable with, and the one that you're actually willing to go see. Something to think about. If this video was helpful for you, please like it. Subscribe to my channel if you want to learn more about PTSD or military culture. But more important than that, if this video was helpful for you, that means it can probably be helpful for another veteran. So I ask that you share it with them. Because at the end of the day, that's really what all of this is about. One veteran trying to help another.